WHO Greenlights pre-approval vaccine purchases to combat African Mpox outbreak by Satori News. The World Health Organization, WHO, has initiated an unprecedented strategy allowing its partners, including UNICEF and Gavi, to procure vaccines against Mpox prior to formal approval by the international health body. This decision underscores an urgent priority to curb the escalating outbreak sweeping across Africa, particularly in regions like the Democratic Republic of Congo. The relaxation of procurement rules represents a significant shift from traditional practices. It typically mandates that organizations like Gavi, an alliance that helps economically challenged nations access vaccines, await WHO's approval before securing immunizations. However, given the pressing circumstances, the WHO aims to fast-track this process, with emergency approvals anticipated in the coming weeks. Two vaccines, developed by Bavarian Nordic and KM Biologics of Denmark and Japan respectively, are currently regulated and authorized in countries such as the United States and Japan. The use of Bavarian Nordic's vaccine has seen more than 1.2 million inoculations in the U.S. alone. The WHO is on track to issue an emergency license for these vaccines by September, enhancing their global availability. Mpox, a virus that spreads via close contact, usually results in mild symptoms but can be fatal. The rapid spread of a new Mpox variant in the Democratic Republic of Congo prompted the WHO to declare the situation a global health emergency. In response, the WHO has solicited vaccine data from manufacturers to expedite its review process and aims to grant an emergency license by mid-September. A concern has emerged with Bavarian Nordic, indicating a critical need for immediate orders to produce sufficient vaccines this year. This urgency brings back memories of the COVID-19 pandemic, when vaccine availability in lower-income countries depended on inconsistent donations from wealthier states. The promised delivery of some Mpox vaccines in Africa by next week, as indicated by the Africa Centers for Disease Control and Prevention, is a part of international efforts to avoid a repeat of such disparities. This measure by the WHO is a testimony to the lessons learned from the COVID-19 pandemic regarding the importance of equitable vaccine distribution. The organization is striving to ensure that countries with fewer resources are not left behind as they face the dual challenges of preparing for and combating the Mpox outbreak. Thank you for choosing Satori News.